Hi, I'm Dr. Ken White, Doctor of Chiropractic. My specialties are acupuncture, sports medicine, and pain relief. I'm glad that you've decided on chiropractic as the way for you to go for your natural health. I'd like to take a few moments to explain chiropractic to you so you'll have a better understanding of what I'm going to do, why I'm going to do it, and how I'm going to do that. The chiropractic profession in this country is over 100 years old. There are, however, references to chiropractic manipulation of the spine and the various parts of the body that go back to the ancient Chinese and as far back as the Egyptians. The chiropractor is described as probably the best biomechanical specialist in the world. And what I mean by that is a living organism and how it fits together and how it functions. For us, our primary emphasis is on the spine, the central nervous system, which comprises the brain and the spinal cord and the nerves where they go out to the various parts of the body. And I'd like to elaborate a little bit on that to give you a little clearer understanding of why I do what I do and how I do it. Basically, we start with the spinal column, which has 7 cervical vertebrae. That's the neck area. Then we have about 12 thoracic vertebrae, which is the more of the trunk area. And then we have the lumbar vertebrae, which are 5 in number, which is the last part. There are 3 major areas of the spine. The cervical area basically supplies the neck, but also has main nerve roots that go down and supply the shoulder, the arms, and down to the hand and the fingertips. The significance of that to you is if you've been suffering with any arm pain, numbness, tingling in the hands and the fingers, that's where that can be coming from. If you get down to the thoracic area, the supply is mostly to the internal organs. In case of that, you might have stomach trouble, some ileocecal valve problem, things that are not functioning properly, maybe some difficulty in breathing. Upper thoracic area, definitely in the asthmatic patients, and the lumbar area, which is the lower back area. When you get down to the lower area, that supplies the internal organ part, mostly the large intestine, male and female organs. The 4th and 5th and 1st sacral segments supply all the way down the legs, down to the toes. That's typical sciatic neuralgia people have where they have pain in the legs. If you're getting numbness and tingling, that can get you into some disc pressure because of the disc relationship in there. Now that I've given you kind of a general overview, I want to get into more of the specifics of the biomechanics that I mentioned earlier. With each vertebrae, it has some specific parts, one being the spinous process, the transverse, and the big body part, which is where most of the weight bearing is on there. But the most important part to us is where the nerve root emits from the spinal column itself. And that's in this intervertebral foramen. When all of that opening space in there is open, there's not a difficulty in here at all, and everything functions well. And the function of that nerve root supplies the skin, the muscles, the internal organs, and the blood supply. So it's very, very inclusive. If there's a disrelationship or an alteration in the biomechanics of that, we begin to lessen the opening size, or what we call occlude the opening, and what that sets up is an inflammatory response to that nerve root. Once you set up the inflammatory response to that, that's what leads to the dysfunction in the body. Again, in the skin, in the muscles, muscle contraction, one of the big things that brings you in. The pain level, as far as the sensory nerves are concerned, to tell you there's something wrong. Or you might have a dysfunction in the organ, something either going on too much or too little, like too much stomach acid or too little stomach acid for digestion. Those are the kind of things that we look for as far as the symptomatology is concerned. That's pretty much in the original stasis. In a normal healthy spine, what you've got is a good healthy disc, plenty of nutrition in there, and that's how it looks with this. So this is kind of a semi-gelatinous material, kind of like a shrimp-like material in there. Lots of resiliency, lots of movement, lots of room for the nerve root, and lots of normal function. The next stage of the deterioration on that is what we call phase 2 or phase 3, where there's been an alteration in the blood flow, either to damage, and you can do this through trauma if you've been in an auto accident, if you've had a major fall or an injury. What generally happens there is that the disc space becomes, the disc itself becomes dehydrated, it becomes stiffer, there's less resiliency in there, it has a tendency to settle down more, which is why you decrease in height as you get older. The nerve root does not have as much room, there's more chance for impingement on that nerve, and obviously more chance for dysfunction. The next phase on that, we call the second to third one, you've got lots of deterioration in the spine. The disc itself can begin to protrude outward, as it does in this case, and that's where you would have the numbness and tingling down the legs and the numbness and tingling in the arms. Lots of dysfunction. The body now starts up its own defense mechanism by throwing in more calcium to try and fuse it together. So it's really actually trying to fuse the vertebrae together so there's less injury, which is fine for the body but not so much for you. One of the big things that happens in there is that that same spinal fusion takes place back in this neural canal, which makes less opening for that nerve root, and also you see the decreased size in the nerve root, so there's less function, less life. The very last stages of that spinal degeneration that we talk about, the Spanish have an excellent word for it. It's called muerte, or death. And if you look at that spinal column, there's no disc. Everything is fusing together. The spinal nerve roots themselves now become atrophied or smaller. They're not functioning as well. And that's the 65, 70-year-old that you see walking around in the malls in either the wheel, with a walker, or else they're in the wheelchair. This is what we want to stop. If we can keep you healthy on this level, that's where you begin. And that's where we talk about chiropractic being a normal, healthy way to living. If you let this stuff go, this is where you end up. And we don't want that. Earlier I mentioned that one of my specialties was sports injuries, and this is where the biomechanics really comes into play. Much of the problem in shoulders and other parts of the extremities is the way things fit together. If they fit together biomechanically, the function is normal. There's no pressure put on the tendons, and there's no pressure put on the muscle units, and the ligaments and all the bursa function well. So we've got a normal, healthy, functioning joint. If any of this structure has been injured, sports injuries, even just a fall where you put your arm on down there, what can happen here is that we disarrange that particular section and it does not return back to normal. This sets up a general capsulitis in the area, which in turn spreads over into the rest of the tissue. And if you've ever had a frozen shoulder syndrome where you know you can't pick your arm up, that's where that comes from. Medically, what we do, what is done is to go ahead and treat it with an anti-inflammatory and a pain reliever and hope that everything will settle in and do well. Unfortunate part of that is most of the time it doesn't do that. The symptoms go away or abate a little bit, but that alteration in the structure is still there. And this is where you begin to feel that restriction in the shoulder, where you start to feel the pain, and eventually gets into the bursa, and the bursa little shock absorbers in there. And once this sets up in there, we have a total inflammatory response and dysfunctional state. What we do in this case is to go ahead and check that out by x-ray and see what the relationship is in there, and then manually correct that so we have a biomechanical establishment back in there in that joint space. The same thing can occur in the hand, in the fingers, in the wrist, carpal tunnel syndrome, where these bones of the radius and the ulna have twisted, and what they're doing now is to encompass and compress on the main nerve channels that go down to the fingers, and that's where you get that numbness and tingling and you can't sleep at night. In the knee probably is one of the most susceptible joints to injury for all you runners out there, or anyone who uses a knee excessively. Again, the same thing can happen. It will torque, lose the biomechanical relationship, create problems on the meniscus, which is another shock absorber in there. Also on the ligaments can be torn or damaged. If they reach that point, then you need surgery. However, prior to that, all that really needs to be done is restore the biomechanics in there and strengthen up the musculature that holds that. Same thing can occur in the foot. As we get a little bit older, what happens with the foot is we begin to drop the arch down, which is the importance of having arch supports put in, especially if you're a runner. You want a good solid orthotic in there that'll work. If you're beginning to get pain in the toes, it's again that disrelationship where we've got a capsulitis again in these. Again, manipulation does very well in that to restore the function and decrease your pain. If you get plantar fasciitis, which is the bottom of the foot pain, again, this long ligament that goes from tendon that goes from here to here becomes involved as that drops and stretches. Orthotics will take that out. So anywhere there's a joint space in the body, you can expect a capsulitis problem or inflammation in that area if the biomechanics have been altered.